Welcome to Remix EQ Live, where we are amplifying equity with a remix of information, interviews, and inspiration. I'm your host, Dr. Erica Tate, and today I'm broadcasting live from Savannah, Georgia, where I live. And for those who are joining us today, please drop a greeting of choice in the comments. Let us know where you are joining from and the equity-driven work you do or aspire to do. And remember, Remix EQ Live is an experience that's meant to be shared. So I encourage you to hit the share or invite buttons and bring along your people, your network, your family, your friends, your peeps to join our Remix EQ Live community today. This season, we are broadcasting live on LinkedIn and YouTube. We can now connect more broadly, growing our reach and building our learning community. While those comments are flowing in and those invitations are flowing out, I want to remind you that Remix EQ Live offers the opportunity for us to connect and build community with each other about the equity-driven work being performed throughout the world. And we do this by centering the work. That is, our guests and viewers share examples of what they do in their role or position as a way to illustrate the innovative, effective, and meaningful ways they advance equity in the places in which they live, work, learn, and play. So throughout the show and in the comments, I invite you to share what you do to make the world a more just place. We are in the second half of Remix EQ Live Season 7, and today I am in the studio with two fierce and loving social justice warriors, Dr. Nkenge Jackson and Demetrius Geiger. Dr. Jackson is a board-certified physician specializing in obstetrics and gynecology. She practices in Savannah, Georgia, and is committed to high standards in medical care and attending to the comfort and needs of her patients. In today's conversation, she is lending us her expertise and experiences caring for Black women throughout the maternity continuum: conception, pregnancy, birth, and postpartum. Demetrius is the Director of Initiatives under the Equity and Impact Department at CHC, Creating Healthier Communities. You might remember her from our HPV and cervical cancer prevention episode earlier this season. Demetrius is a passionate advocate for health equity, birth equity, and reproductive justice, and is on a personal mission to create positive, lasting change in the communities she serves. In today's conversation, she's sharing her experiences and learning from her community-based work, improving maternal outcomes for Black women and their babies. As a Black mama, I'm excited that today's conversation is happening during Black Maternal Health Week, which is championed by Black Mamas Matter and happens every April 11th through 17th. It is my hope that this conversation brings awareness to the Black maternal health crisis in the United States and specifically in Georgia, and amplifies clinical and community approaches to improving Black maternal health. You are invited to listen and learn from Dr. Jackson and Demetrius, who are also Black mamas, about their practice, their advocacy, and their pursuits to make the world a more just place for Black mothers and parents, their babies, and their communities. So let's begin this conversation for change. Welcome, Dr. Jackson. Welcome back, Demetrius.
Thank you for inviting me, Dr. Tate. Thank
Of
you.
course, of course. So, Dr. Jackson, I invite you to introduce yourself, and as you do, please share 1 to 2 career or personal twists and turns that have led you to your current role.
All right. I'm Dr. Nkenge Jackson. I'm a board certified obstetrician and gynecologist. I've been in the Savannah area for about 17 years. My twist and turn is that I started my career in Ohio. However, we have a family museum project that we started in 2005. The museum is called the Willow Hill Heritage and Renaissance Center. It's an African American history museum in Bullitt County, Georgia. So that project brought me to this region.
I love it.
So
I love
that's
it.
my twist and turn.
Yeah.
Not exactly health related, but something that has helped me to appreciate the challenges that people of color, particularly African Americans, have had through their journey from enslavement to the present.
Mhm.
In the community that the museum is in was started by my ancestors during Reconstruction in the 1870s. And
Wow.
so we actually have records in our archives of a midwife that was born in the 1890s that practiced in the 30s, 40s, and 50s. And so through our archival records, we have been able to shine a light on some historical norms during that time. So that's my twist and turn.
Well, I'm glad that twist and turn landed you here. Thank you so much. And welcome back, Demetrius. So, again, I invite you to reintroduce yourself. And as you do, please share one or two career or personal twists and turns that led you to your current role.
So, hi everyone. Again, Demetrius Geiger. I'm the director of initiatives at CHC. I actually obtained my master's in public health from Morehouse School of Medicine. So, I've been deeply engaged in community-based participatory research and just I'm always been about civic service in general. And so, a couple of twists and turns. I also like to say I'm still early in my career. I feel like. So I think some twists and turns for me is that initially, and this often happens in our communities, depending on, how much exposure you have, that I initially wanted to go into medicine. I've always had a passion for caring for women in general. I love babies. I love children. I've always been a nurturer at heart. And so initially I wanted to go actually be an OB. Dr. Jackson, this is kind of crazy. Practicing OB or either peds. But as I evolved and after my undergrad, things started to change. I took a gap year or so. And I stumbled upon public health, a broader approach, and to understand with that exposure that there's other careers out there besides being a doctor, a lawyer, and things of that sort. And I still can touch people's lives in many different ways. And also now that I'm an adult, like the fluidity and things, like honestly is in my nature. So this calling is very much so for me. And I'm still able to work with physicians and things to do this great work. And then secondly, another twist and turn as far as my current position here in working with CHC, it's odd that we're talking about maternal health is that, during my postpartum, a lot of decisions were made. And so it actually led me to this organization I work for now, enabling the opportunity for me to be more of a thought leader in that strategic thinking in maternal health space versus strictly research. And so those are my twists and turns.
Oh, well, thank you so much for sharing them. We're so glad that you're here, both of you, and excited for the conversation that lies ahead. We have some people in the audience. Hello, Brianna Matchett. Good morning. She says, good morning, Dr. Nkenge Jackson and Demetrius Geiger, Black
Good
Maternal
morning.
Health with a party hat. Oh, thank you and welcome. And then Terrell says, good morning. And she has shared the link. Thank you so much. Welcome. Good to see you. So for those who are just joining us, this is Remix EQ Live. We are amplifying equity through a remix of information, interviews, and inspiration. And now that you've had the chance to meet or reconnect with Dr. Nkenge Jackson and Demetrius Geiger, I know you're inviting others to tune in. And of course, I invite you to interact with us. So please post comments to say hello, ask questions, share examples and learnings as we jump and dig in to this interview. You are part of our Remix EQ Live experience. Now we center the work. This is an opportunity for us to learn from Dr. Jackson and Demetrius about how they work to make the world a more just place, specifically how their clinical and community efforts address the Black maternal health crisis and improve health outcomes among Black mothers and their babies here in Georgia. Before they drop knowledge on us, I wanted to share a couple of health disparity statistics that paint the picture of Black maternal health crisis. According to the Centers for Disease Control and Prevention, also known as the CDC, Black women in the U.S. are 3 times more likely to die from a pregnancy-related cause than white women. And the CDC also notes that more than 80% of pregnancy-related deaths are preventable. And the 2024 March of Dimes report card gives Georgia a preterm birth grade of F, Preterm means the baby was born before 37 weeks. And in Georgia, Black babies are 1.5 times more likely to be preterm than all other babies. So, Dr. Jackson, from your perspective as a board certified obstetrician, gynecologist, what factors contribute to this Black maternal health crisis, and how do you work to improve Black maternal health in your local medical practice?
Thank you for the question. So my practice is in Savannah, Georgia, and surrounding Savannah, there are several rural counties, and most of those counties have very few providers, some only one or two. Several hospitals have closed their obstetric units. And so, one issue that I see with patients who come to see me is that they have to travel quite a distance, some 1 to 2 hours, to find a provider who will accept their health insurance, or to find a provider that will allow them the self pay option. So, that's a major barrier. The second trend is that patients who in previous pregnancies had the ability to get health insurance, for example, Medicaid, we're seeing higher rates of patients not being able to get the insurance, or getting delays in being insured. So one great thing about my practice is it's affiliated with the Curtis V. Cooper Community Health Center, which is a federally qualified community health center. So we do have the ability to see patients despite their ability to pay. And so we have a program in conjunction with Candler Hospital for patients who do not have insurance. And so patients travel quite a distance to participate in that program. And so the other trend is that a lot of patients are either not insured or underinsured. We also have patients that do not have access to a provider for care, like a primary care provider outside of pregnancy. So when they come to us, they may have a health condition that's unmanaged, like type 2 diabetes or hypertension. And so if the patient presents early, we have a little bit more time, but we're seeing a lot of late entrance to care, 25, 26 weeks with coexisting conditions, and it can make it a challenge to catch that person up with their prenatal care. In our practice through Curtis V. Cooper, we also take care of a large population of patients where English is a second language, from many different countries in Asia, in the Caribbean, a lot of the Spanish-speaking countries. So a lot of different patients. And so sometimes the visits are conducted with the use of a translator. And so all of these can be quite challenging against the backdrop of a provider shortage. And so what we are experiencing in this area is that there's a lot of need. There are only a few providers, and so wait times can be long, access can be a challenge. And so those are the current barriers that we see in our area.
Thank you. Thank you for adding the details, right, to the picture about the Black maternal health crisis, the transportation, like the structural barriers, access, language, and the ways that you are able to address those as best you can. Demetrius, in your role as the Director of Initiatives under the Equity and Impact Department at CHC, Creating Healthier Communities, you also consider non-clinical factors and how that contributes to Black maternal health. So what are some of these key non-clinical factors, and how do you address them as you work to improve Black maternal health in communities?
Thank you. Thank you. So, like you mentioned, really my role and my team really focuses on working with the community organizations and people to address these non-clinical drivers of the Black maternal health crisis. And really, as it relates to like the weathering effect, that chronic stress that Black women have. I mean, we carry it before we even, conception, right? And also the impact of racism, and these factors build up over time and lead to these adverse health outcomes. And so honestly, as a Black woman also, and based on the literature, we know things like a higher income or educational attainment, it does not necessarily shield us, or they're not protective factors when it comes to these maternal health risks. So rich, again, is rooted in systemic inequity. And so we also look closely at social determinants of health. I know, Dr. Jackson, you mentioned that transportation, how long does it take a patient to actually truly access care? We look at things like housing, food access, and whether a mama is receiving culturally competent care as they deserve. And so it's also important for us to talk about implicit bias of providers, some providers, the institutional barriers that we mentioned, like maybe with insurance. We talked about if there's a language barrier, things of that sort that can prevent someone from having respectful, responsive care. And also, in addition to the physicians, we also focus on having access to birth workers, whether that's a community health worker, a doula, who are very vital to supporting that mama, during birth, pregnancy, and postpartum. And so they are really essential to the care team. So really, in summary, with CDC's Black Birthing Initiative, we do aim to decrease preterm birth factors among Black women and birthing people by addressing that stress, that medical racism, that unmet social determinant of health needs. And the BBI is a community-based intervention model that offers that non-clinical support to advance that Black birth outcome. And so that really involves us disseminating a tailored tool so we can assess their stressors over time, and then also engage them and connect them with a doula to go over these 6 core elements, right? We make sure they get screened and assessed over time. That is important. Routine assessments. They get that high touch case management and research referrals. If they need anything, an SDOH barrier, we make sure that's taken care of. They get prenatal education, advocacy, that social programming, that belonging with other mamas. We make sure they get that. And then lastly, of course, birth accompaniment, that doula is there to serve them during their labor and delivery. So I'll stop there. I know that was a lot.
No, that's great. Thank you for sharing like the care team. Like, do you have a tool that makes sure that patients or clients are getting the screening and the routine care that they need to get throughout the pregnancy. And I love, they get to get connected to other mothers, right, in this process and building that community. So thank you. And we're going to talk more and more about care teams and interactions later. But I did want to take a moment to acknowledge that both Dr. Jackson and Demetrius have contributed to research in this area or work on projects in this area as either to figure out or learn more about what factors are contributing to the crisis or determining what intervention or aspects of interventions best support Black women's maternal health experiences. So I want to start with you, Dr. Jackson. So you've been part of a project called the Georgia Moms Project. So quickly, what is the Georgia Moms Project and why did you become involved with it?
Great question. So when these statistics started to come out about the morbidity and mortality rates, particularly of Black women, it was amazing as a provider, probably in the epicenter of what was happening. I wanted to know, was there something that I could do? So it started out as very personal. I had a relationship with Dr. Heidi Altman at Georgia Southern University, who worked with us at the museum. She's an anthropologist. And so when I talked to her about what I felt were my concerns, she thought that we could design a qualitative study, which is a little different from a quantitative study, where we interview women who've had deliveries or had a birth in Georgia over the past 10 years. And once the data was gathered, you then start to see what the trends or the concerns are. So it's instead of kind of from the top down, it's more from a patient-centered approach. And there are some interesting themes that have come out in terms of patients needing community, needing to address things like postpartum depression, needing to feel listened to. There's just a lot of interesting findings, and I know at some later point we'll have Dr. Altman come and talk about her findings. But I think from that aspect, it was just very cathartic and empowering for those patients who participated, because it was maybe the only place that they had to even talk about that birth experience. And as a provider, now these were interviews from all over Georgia, but just getting to be associated with that, I think has helped me as a clinician as well. It can feel from the provider side like there's a lot for each individual that may need to be done. And it's clear to me that collaborations are the key.
Yep.
So, what you're providing as that external support to the moms and the other programs that are out there, if we could create synergy in terms of working with a provider to kind of lift some of the weight and spread it across community, I think overall, and I think that's the direction that we're going to hopefully be able to reverse this trend. But it's not a solo project where one provider or one practice can solve this. It really is a community effort. So I just appreciate that you're bringing all of this together, because I think that this is really the answer.
Oh, thank you for sharing. My favorite methodology is an interview. So I really appreciate the opportunity to give space and invite women to share their experiences, especially when we know Black women often report that they may feel unheard or ignored throughout that process. And they have a chance to speak and share it, and that it's informing your clinical practice, it's informing community efforts. And I love that collaboration is what's emerging, because it really is this collective sense that's going to improve this crisis. And so I love it. I'm like, collaboration make me very happy in my heart. And Demetrius, you shared a bit about the Black Birthing Initiative, which is a community collaborative that informs research. And so I wanted you to give you the space to share what steps you took to establish this research project as a community collective.
Well, first, I want to very much so thank Dr. Jackson for, of course, not only just serving patients, but stepping into that community role, uplifting voices. I so appreciate you. So yes, there's definitely some collaboration coming soon. I know you're busy. But as far as the Black Birthing Initiative, we do very much so, like Dr. Jackson mentioned, take that top-down approach, people-centered approach, right? So when we actually designed the BBI, we engaged the community. So we didn't put something in front of them and say, hey, this is what we want to do, X, Y, and Z, right? So we actually engage Black birthing people. There are some birth advocates, doulas, the local maternal health leaders in each community context that we were working with, right? To make sure that they co-created these solutions that they clearly need and deserve. So to establish the BBI as a true community collaborative with us, we began by listening first. We hosted these community listening sessions, focus groups, some key informant interviews. And so not just once we did this throughout the whole BBI process. And then we also partnered with, the CBOs and the birth advocates that were already doing the work. And we had a shared governance model so that we were uplifting the community voices based on what we heard. That guided us, that informed how we actually developed the framework and the implementation guide for the BBI. And so that's essentially how we did that. I want to say for each community, the aim was to stay in each community for a week. And I know like people are like, what? Yes, each community we stayed a week. So to give some context, we now we launched, but the BBI in Atlanta, Cleveland, Detroit, and Indianapolis. So we spent the week in each of those communities before we actually designed the implementation guide.
That's really great. I love it. Shared governance model. Could you like, what does that entail?
So what it really entails is like, honestly, is when I mentioned that approach of that process where we engage that community throughout. So like literally we make sure we sat down and said, hey, what are the things that you're seeing coming up? How can we better serve you as a community? Things of that sort, right? So when we developed that framework, it was a shared framework. We don't solely own the framework. We don't solely own the data. The community owns it. So that's what I mean about that kind of shared governance model there, and also that research process that they are experts. You know, we lean in your expertise. You live in these communities, you have the solutions. So oftentimes people wear these hats, but they have to understand that you don't have to have alphabet soup behind your name to be an expert. They are living through this every day. So we lean into that and we share ownership with them in the community.
Thank you. Thanks for elaborating that. I think it's like, one, like having that opportunity to go into the communities and speak to the people which this is affecting the most and listening, but then also I think the point that you added about the framework is shared with them, the data is shared with them, like this whole process is with them. And it's not just that we listened at the beginning and then went on and did our whole way, but like throughout the process, community is still engaged and involved. And I think that's an excellent strategy to uplift and model for people to think about throughout the whole process, right? Like when and how are you listening to community and taking that input in? So thank you. I think Terrell, I see, had left a comment a little while ago. I love that. I think she was listening to all the great things that you were sharing about your programs, and she's certainly going to share this vital info with a coworker. Yeah. Learn it, share it. It's important. So thank you so much. And then I wanted to move to care teams because I know that was mentioned when I think, Demetrius, when you were talking about the Black Birthing Initiative and some of the features. And so a care team provides support to women during their maternal health journey. And it can include a provider like an OBGYN, like Dr. Jackson, but like a nurse, midwife, a doula, or other birth advocates or birth workers. So I wanted to ask you, Dr. Jackson, as a physician, what experiences or interactions with care teams do you find to be most supportive to Black women in your care?
So, in terms of the model where I am, we do utilize nurse practitioners in the office. Once again, there's a shortage, so it's impossible for the providers that we have to fill all the needs. So typically the model is you see the provider, but there are also nurse practitioners that you will see. We don't have any doulas that are actively at the hospital. However, I have had the experience of one that was in training who asked if she could, help to manage a couple patients, and that collaboration worked very well. She was able to be that support, and I would say it was more emotional support. It was I'm concerned about this. I can call you and you can let me know if this is something that, I should call my provider about, so if they were afraid to do that. And so I felt that it was collaborative and I felt that the patients greatly benefited. And, so that is my experience. So I know that the model can work. It's just about, maybe developing those early relationships that can open the door to that. So that's my experience, and I do get a sense that women are aware. I mean, they're hearing the same statistics that we're all quoting, and they're coming into the experience afraid. What's going to happen to me? Am I going to be okay? And so having that person that they can lean on who can help them understand the process and understand the environment and the culture is priceless, really. And so even in my own practice, I find that part of it is the didactic stuff or measuring your belly and listening to the heart, but a lot of it is developing rapport, helping them to feel comfortable and not afraid of the experience. And so I think that is the value. And there is a lot to be said for with that word cultural competence, knowing those cues that may not be said, being able to look and realize that they might be afraid or they might want to ask a question. And also being in an environment where people feel comfortable. So I've heard from some people, I'm sorry that I won't come back to see you guys because it's almost like I come and I'm with friends, even though it's a health experience. So I would say that in my sense, yes, the medical part, that matters, but it's also the emotional support that's really, really important at this time.
Thank you. Thank you for sharing that and underscoring that emotional support. And I think it's really, I don't know, important to hear that from a provider. I mean, from all, but yes, like, of course, we're doing the things that, we do for standard of care, but also we care, right? We care about your whole person. So thank you. And then, Demetrius, so your work with the BBI, you work with doulas and other birthing advocates. So from your perspective, what care team practices do you find most supportive for Black women?
Again, I have to give kudos to Dr. Jackson because it warms my heart because, we don't hear that from all physicians are not like that, like where it's not a welcoming, because it sometimes like when a doula is integrated or they're present, it could cause some tension in the room. But I really love your openness to it and your experience in general and how it's essential. So I lean into that, and we appreciate you. And doulas and birth advocates, they do provide that continuous high touch support that can help bridge any gaps that maybe aren't addressed in that time frame during a medical visit. And I love that, again, future collaboration to really, how do we further bridge that gap? Like, how do we get that information, a certain information over to that physician? So something that they may not be able to take care of at that time, but they're aware of it. And again, building that rapport, integrating that in the conversations with the patient. I love it. So I think one key thing that we uplift in general for Black Birthing Initiative is that, respectful care. We really uplift the Black Birthing Bill of Rights. It's a resource for self-advocacy. It's a call to action for mamas, for institutions, for policymakers to understand and affirms that we Black people, Black women, Black mamas, we are entitled to respectful, equitable care, high quality care throughout the journey, right? So making sure we follow that practice, making sure we uplift autonomy, voices, and dignity in birth. It's our birth, right? So I want to say that's the practice that we really focus on and we center. But yeah, so I know y'all, I'm super. But yes.
That's why you're here. It's the passion that brings you to the work. Oh, no, thank you. And I appreciate you both sharing about care teams. I'm going to say, I don't know how familiar everyone is with that and how they can pull those things together and that these are resources that are really supportive, but also that in care teams, you have really underscored communication and centering the patient and really those things that make teamwork and collaboration work. But those are how the people who are there to advocate for you and keep you safe, those things need to happen among them in order for that respectful, dignified birth that you were speaking about, Demetrius. Thank you. So throughout the conversation, right, advocacy has really emerged as a theme, and advocacy, both personally, advocating for yourself and community partners advocating for you. So I wanted to ask both of you, what is one piece of advice that you can share with Black women and birthing people to encourage and support them to advocate for themselves throughout their maternal health journey. So I can start with you, Dr. Jackson, and then Demetrius.
So healthcare is a system, and the system has many parts. And during a healthcare journey, you're going to interact with the system in different ways, maybe through the emergency room, maybe through, who sees you if you go to the hospital, down to your provider. So I would say the first step is to find a provider who aligns with your thoughts and care. And I think it's good early on to have that conversation. I would like to do XYZ. How do you feel about that? I think that's a really, really important first step. And the second step is that in different environments, the approach to advocacy may be different. So there's some soft skills that may need to be engaged when you're in the middle of care. Mm-hmm. And the one thing that you have to be very careful about if you haven't really established that rapport with your provider and may not be unaware of the culture of where you are, is that you have to be very careful not to alienate the care team. And that's a really important subtle thing. So in the middle of certain types of care, even I, as a provider in the middle of my C-section, have zero control. So it's very important that the person who's caring for you, that you've established that trust, and that if there is something that you want to change, maybe you can go to that provider to then advocate the change versus, going directly if you don't know the environment. That would be a piece of advice. What I have seen sometimes is that in the middle of care, because of something that may be perceived or something that's real, then if the walls come up, it's a barrier to care. Mm-hmm. And I think that sometimes those walls are in response to, of course, what you hear, of course, what you may feel, but it's a too much of a challenge to do it by yourself. So that's where your advocates step in. That if I have a concern about my interaction with a nurse or someone, if I feel comfortable and I can speak to my physician, that person can go and be my advocate. And then it leaves me in a neutral space with my care team. And so that might be something that can be flushed out and developed more as those collaborators who get together, you said collaboration is there, really talk about what are the challenges that happen during care. Mm-hmm. What's the best approach? What's the toolkit that we can give the patient to make sure, because the number one thing is you want a good outcome, that in the middle of that, the team's not stepping away because now it's, something's interfered with that. And so that's the only piece of advice that I think is a critical piece, but I don't even have all the answers to that.
Yeah. Thank you. And then Demetrius.
Yes, it's so much out there, right, Dr. Jackson? Like, I don't have all the answers either, but just, from personal experience and what we've seen, like, honestly, staying authentic, but also persistent, like honing in and actually finding that champion, not only your birth advocate, but like, as Dr. Jackson mentioned, if somebody in that practice you can find to be your champion, if you're not getting the right care that you need, build a relationship with that person, because some folks don't have, in my experience, I went with a second option. I had that choice. Everyone doesn't. So I would say definitely find that champion, but also being authentic and being able to vocalize. And unfortunately, in some settings, as Dr. Jackson mentioned, advocacy can be perceived in many different ways, but being strategic about it, unfortunately, I think those are like the biggest advices I could give. And also don't be afraid to do your own research. And I don't want to say challenge your physician, but making sure you're being vocal about your concerns and your needs and to get a better outcome is what I would say. But there's probably much more out there. But yes, those are ones that come to mind.
And most healthcare systems have what is called a patient advocate.
Mm-hmm.
So if you are being challenged with something, so this is like at the hospital level,
Mm-hmm.
and you really feel like something isn't right, you can first start with the manager. You can then connect with a patient advocate. Sometimes that will get you more than the direct option, and even though that seems a little strange, but for minor issues, yes. But if there is something that you feel is major, I think you should get an advocate around you.
Yeah.
Oh, thank you so much for that advice. One thing I feel like I take away as I'm listening to both of you throughout the conversation is that like, this journey is not for you to do by yourself, right? Like you really need to, not really need, but I mean, like there's really opportunity to like empower women to identify advocates before and during and along the way, and also like there's a opportunity for many other people to be advocates for these women as they walk through. Like I just think there's just so many places that both I think in clinical settings and community settings that people can step in and also support and be advocates. And I think you guys have raised so many different ways for that to happen. And you don't have to be the doctor or the nurse midwife, right? You could be the friend who comes along with them. You could be the friend that refers them to a program like the Black Birthing Initiative. You could be the friend that goes with them to talk to the patient advocate in the hospital. Like it's just so many ways to advocate and support. And I think, I don't know, like you're showing us like these step in. So it's good. It's good. I'm like,
you say it all the time. It takes a village, and I know the village looks different today than it did before. Yeah.
Like, what can we do? So we're coming to a close. But as you know, each episode, our guests drop knowledge. They drop inspiration about how they work to make the world a more just place. And Dr. Nkenge Jackson and Demetrius Geiger, you've done just that by providing all of your insights and passion and helping us understand how you've come to understand the Black maternal health crisis, and then how and why you've chosen to improve maternal health outcomes and experiences for Black women and people who give birth to the babies. So I appreciate it. So before we leave, I'd love for you guys to drop one last piece of inspiration on us. So I'll ask you both the same question. I've been asking this question all season. But as you reflect on your roles and your efforts to improve Black maternal health outcomes, what are you most inspired by? And how is this inspiration influencing your next steps? And this time we'll go Demetrius and Dr. Jackson.
Honestly, I think what inspires me, like, wow, I am so just thrilled about the collective that Black folks are in this space. We are taking charge, right? I absolutely am so inspired. Like I mentioned to you, like I've been so liberated because I can be so authentic in those spaces, and we're really coming together as a collective to make sure that we are supporting each other in the merit ways that we need to. Honestly, that truly drives me, because we really need each other, and we have been coming together in our unique ways to make sure that we get the care that we deserve and also build that community. So yeah.
Thank you. And Dr. Jackson.
I'm just inspired by the work of others. This opportunity has allowed me to find out something new. And I know that there's a lot of great work out there, and at some point it's all going to come together and improve care. But I just, every day, those one-on-one interactions with my patients, particularly when you get to that successful delivery, that's my joy. I still enjoy what I do.
Oh, I love it. I love it. Well, thank you so much. Oh, Terrell said, in the future, I would love for you guys to discuss the perimenopause and menopause journey for Black women. I'm
Oh,
there and finding the support is challenging. Oh, you know what, girl? Yes.
yes,
Thank
we
you for
do.
suggesting topics.
You're in my mind.
Yeah,
Okay, connect. 'Cause, yeah.
I love it. Yes. I'm here for it. Good. Thanks. Well, thank you, Dr. Nkenge Jackson and Demetrius Geiger, for accepting my invitation to speak about what matters most to you. I am grateful for the opportunity to listen and learn from you, especially about how and why you've chosen to make it a more just a place. So I'll do a couple announcements and then we'll head off. But thank you guys so much.
Thank you
Oh,
for
I'm so
inviting me.
So just a reminder, we're here on the second and fourth Fridays at 11:30 a.m. So we'll be back on April 25th. I'm sitting down with Andre M. Perry, a senior fellow at Brookings Metro and the director of Brookings Center for Community Uplift, and author of the book Black Power Scorecard, Measuring the Racial Gap and What We Can Do to Close It, and Know Your Price, Valuing Black Lives and Property in America's Black Cities. We'll be discussing his latest book, which is Black Power Scorecard, and continuing another theme of conversations we've been having this season on closing the Black wealth gap and increasing our collective power. So tune in on LinkedIn and YouTube, and also like and share upcoming and past shows, and be sure to subscribe to our YouTube channel. Now that we are in season 7, we've created a substantial and inspirational body of work. We have 50 plus episodes, which we've curated into playlists for your viewing and listening pleasure. So if you like today's show, be sure to check it out on one of our Remix EQ live playlists. And so for this show, if you were really into it, you can check out our health, equity, and wellness playlist. Savannah 912 playlist because we're local. I need to make like a Georgia and then amplifying women playlist, of course. I also invite you to check out my recent TEDx talk entitled Building Community to Make the World a More Just Place, which was inspired by the Remix EQ Live experience with guests like the ones today, and also for those who join in. And please visit our webpage for episode announcements, recordings, and you can also learn and gather more information about our inspiring guests. There you can also discover new ways to support the community through a love offering or purchasing our merch. We have t-shirts and notebooks. And then while you're on the show's webpage, or if you are engaged in a little justice-inspired retail therapy, please poke around the website and learn more about my business, Blue Knowledge, which advances equity in schools and communities through collaborative research, inclusive evaluation, and equity-driven professional and community learning. Connect with us on LinkedIn. Follow us on the Blue Knowledge YouTube channel, and you can also subscribe to our newsletter. And of course, you can connect with me in these digital streets. And if you're in Savannah, in the actual streets, I'm happy to do that with you. So thank you, Remix EQ community, for your engagement, your encouragement, and your rally, which is how we recognize, appreciate, learn, love, and take care of you as you work to make the world a more just place. I'm your host, Dr. Erica Tate, and this is Remix EQ Live. And we'll see you next time.